Now, with moves afoot to allow medicinal cannabis to be grown and sold in New Zealand and a referendum on decriminalising cannabis, what is the situation and what are the products and the pros and cons? To answer our questions is our resident doctor, Frances Pitsillis. Good morning to you, Dr. Frances.
Good morning.
This is a really interesting topic which I think we don't know enough about going into this referendum. First up, I would like to know what is it? What is medicinal or medical cannabis?
Well, this is what I wasn't sure about, and I actually think that if I'm not sure, I think a lot of people are not sure, so I sort of made it my business to work it all out. Now, the New Zealand Ministry of Health prefers the term cannabis products. And I've been thinking about this, and I think to help the public, I think the way they should think about it is marijuana,
being the
marijuana,
illegal drug.
the actual, marijuana, products that are produced for special use and that are limited at the moment, and then CBD oil, cannabinoid oil, which is currently prescribed.
So that's what's currently legal,
Yes.
but the middle one that you mentioned isn't.
Basically a plant, a cannabis plant is not legal.
The plant is not legal. Now, before I go on to that, the term that the Ministry of Health is using covers all of these products, this cannabis-based products term, and it includes all the different products with varying amounts of two important ingredients. One of them is THC for short, or tetrahydrocannabinol, and that's the one that gives you the high and the psychic symptoms, right? And then there's the other ingredient called cannabinol, which is not psychoactive, and that is in the CBD oil that is prescribed.
Okay, so that doesn't have the THC in it?
No, well, it's supposed to have less than 2% in it.
Right.
Okay, and that's made. So, is it legal for anyone to have marijuana? No, but last year in December, they made it legal that you can buy it if you've got less than 12 months to live.
Oh, okay.
Right, so that's where that's happening now. It's quite legal for terminal care people to use it and buy it safely. Now, by April next year, the government will have set up the medicinal cannabis scheme. And this is where it's going to set up a structure whereby people can apply and be licensed to manufacture and import it, and they'll set standards.
Okay.
Now, that's ahead of the referendum later in the year
during the election
for marijuana, right?
So why would people be looking to use cannabis products apart from those who want to
recreational.
get high? Recreational.
So recreational, and then there's a whole lot of people that are terminally ill, and people with chronic pain that aren't getting good enough relief from what they're doing. Or people, there's a special product for multiple sclerosis, epilepsy, anxiety, sleep, depression. There is potential for the CBD oil, which I can prescribe, to help with all these things, but help to reduce the need for narcotic pain relievers and psychiatric drugs and things like that have worse side effects than the CBD oil. So maybe making someone's regime a bit more comfortable and safer. So, and it may even help to reduce addiction to narcotics and illicit drugs.
Okay, so what does the research show? What do patients that are using this now tell us or you about how effective this is as a treatment?
Now, there's a little bit of research quoted on the MedSafe New Zealand site, which I've used to quote here. But what I have found is that the research hasn't been very clear because they've mixed up all the products. And the best research is in the last 4 to 5 years, and we need more. Okay, because I've been trying to tease out the CBD oil, but a lot of the research has the THC product as well. So this is what the research says. They have very good evidence for chronic pain, including neuropathic pain. Now that's a godsend for people. Spasticity, nausea and vomiting, especially if you're having chemotherapy, and anxiety. And then moderate evidence for sleep problems, appetite, especially for chemotherapy, fibromyalgia, post-traumatic stress disorder, and some Parkinson's, but we need more evidence for that, and we need more research. But they have been talking about the agitation of dementia, bladder dysfunction and some childhood epilepsies, glaucoma and Tourette's syndrome.
Wow.
Some of the public sites talk about Tourette's syndrome.
I'm sure a lot of people are concerned though, just quickly, are cannabis products addictive?
That's very important, about 9%, and if you compare that with tobacco, it's 32%, and alcohol is 15%.
Okay, fantastic.
Yeah.
Dr. Francis, just very quickly, side effects, positive and negative?
Well, positive, mostly people talk about the relaxed, peaceful thing. I've had limited experience prescribing it, but I've had positive feedback. People have been able to come off their drugs and cope much better with life. Negative, and I think it's the THC, a feeling high, but also dry mouth, foggy brain, sleepy and thirsty.
Excellent. Always a wealth of information, Dr. Francis. Thank you so much. And for more information from Dr. Francis, you can visit her website, drfrancis.co.nz.